Hello guys, how are you? I hope so that you will be fine and enjoying a good health. Today's my topic is on type of insulin. So let's first start with types of insulin. Human insulin and insulin analogs are available for insulin replacement therapy. Insulins also are classified by the timing of their action in your body, specifically how quickly they start to act, when they have a maximal effect, and how long they act. Insulin analogs have been developed because human insulins have limitations when injected under the skin. In high concentrations, such as in a vial or cartridge, human and or also animal insulin clump together. This clumping causes slow and unpredictable absorption from the subcutaneous tissue and a dose-dependent duration of action. It means that the larger the dose, the longer the effect or duration. In contrast, insulin analogs have a more predictable duration of action. The rapid-acting insulin analogs work more quickly, and the long-acting insulin analogs last longer and have a more even peak-less effect. Now we will go for a background of insulin. As you know that insulin has been available since 1925 and it was initially extracted from beef and pork pancreases. In early 1980s, technology became available to produce human insulin synthetically, and synthetic human insulin has replaced beef and pork insulin in the United States, and now insulin analogs are replacing human insulin. So now let us discuss about the characteristics of insulin. Insulin are characterized by differences in onset, how quickly they act, their peak, how long it takes to achieve the maximum impact, then their duration, how long they last before they wear off, and the concentration. Insulin sold in the US have a concentration of 100 units per ml or unit 100. In other countries, additional concentrations are available. If you purchase insulin abroad, be sure it is unit 100. Then route of delivery affects whether they are injected under the skin or even intravenously. Insulin is usually injected into the fatty tissues just under the skin. This is also called subcutaneous tissue. And now we will discuss about the types of insulin. There are three main groups of insulin. First is fast acting, then is intermediate acting, and then in the last is long acting insulin. What are fast acting insulins? They are absorbed quickly from your fat tissue subcutaneous into the bloodstream, and they may be used to control the blood sugar during meals and snacks and to correct your high blood sugars. And these include rapid acting insulin analogs, insulin aspart, insulin lispro, insulin glulicine, which have an onset of action of 5 to 10 minutes, peak effect in 1 to 2 hours, and duration of action that lasts 4 to 6 hours. With all doses, large and small, the onset of action and the time to peak effect is similar. The duration of insulin action is, however, affected by the dose. So a few units may last 4 hours or less, while 25 or 30 units may last 5 to 6 hours. As a general rule, assume that these insulins have duration of the action of 4 hours. Then we will come to the regular human insulin, which has an onset of action of half to 1 hour, peak effect in 2 to 4 hours, and duration of action of 6 to 8 hours. The larger the dose of regular, the faster the onset of action, but the longer the time to peak effect and the longer the duration of effect. Then there are immediate acting insulin, and they absorb more slowly and last longer. And they can be used to control the blood sugar overnight while fasting and between meals. And these include NPH human insulin, which has an onset of insulin effect of 1 to 2 hours, a peak effect of 4 to 6 hours, and duration of action of more than 12 hours. Very small doses will have an earlier peak effect and shorter duration of action, while higher doses will have a longer time to peak effect and prolonged duration. Then we have pre-mixed insulin, which is NPH pre-mixed with either regular human insulin or a rapid-acting insulin analog. The insulin action profile is a combination of the short and intermediate-acting insulins. Then we will talk about the long-acting insulins. They are absorbed slowly and has a minimal peak effect and a stable plateau effect that lasts most of the day. And they are used to control the blood sugar overnight while fasting and between meals. And these include long-acting insulin analogs, insulin glargine, insulin detimir, which have an onset of insulin effect in 1.5 hours to 2 hours. The insulin effect plateaus over the next few hours and is followed by relatively flat duration of action that lasts 12 to 24 hours for insulin detimir and 24 hours for insulin glargine. Then now we will compare the type of insulin and their onset and the peak and duration and appearance. For fast acting, then we will talk about the regular insulin, which has an onset of action within half to 1 hour and its peaks within 2 to 4 hours, and the duration of action is about 6 to 8 hours. And then Lespro or aspart glulicine, that has an onset of action within less than 15 minutes. Their peak effect lasts 1 to 2 hours and duration of action lasts for 4 to 6 hours. Then we have intermediate acting NPH that has an onset of 1 to 2 hours and the peak effect occurs at 6 to 10 hours and the duration of action is more than 12 hours and it is cloudy in appearance. And then we will come to the long acting, which are two types, detimir and glargine. Detimir will have an onset of action within 1 hour and it peaks will be maximum effect in 5 hours and duration of action is 12 to 24 hours and it has an appearance, clear appearance. And glargine, it has onset of action within 1.5 hours, flat maximum effect in 5 hours and duration of action within 24 hours. So activity profiles of different type of insulin we get about insulin lispro, aspart, glucin, regular, NPH insulin, detimir, insulin glargine, according to the time on one side of a graph and according to glucose infusion rate, milligram per kg per minute. So we will get a graph. So these graph will also give us information about insulin, their actions and how they work. So to learn about the different type of insulin, see other actions which will be very beneficial for you. So if you have any query, you can ask and we can give you suggestions which insulin will be helpful for you. Insulin can be given by the pump therapy. And what are insulin treatment tips? We can tell you about intensive insulin therapy. We can tell you about designing an insulin regimen. So first of all, I will talk about insulin administration. Insulin administration, we have two routes of delivery. That one, first one is the injection route and the other one is the infusion route. Injection is the most common type we give by the insulin syringe delivery method, and the classic injection device is an insulin syringe. The plastic disposable syringe currently are available in three sizes and up to 30, 50 and 100 units of insulin. The needles are fine up to 31 gauge with length ranging from 3/1/16 of an inch for infant to half inch or more for adults, and the insulin is injected into the layer of fat subcutaneous tissue just under the skin. And rarely insulin may be injected into a muscle. This should happen only under a medical supervision in a hospital or a medical care setting. And then we have insulin pen. A popular alternative to insulin syringe is an insulin pen. Insulin pen has a replaceable reservoir of insulin called a cartridge, a replaceable needle to puncture the skin and to deliver insulin to the subcutaneous tissue, a dial to choose the insulin dose, and a mechanical pumping or insulin release mechanism. These may be disposable devices or reusable devices with disposable insulin cartridges. They are very convenient for active in individuals taking multiple injections as well as those who are visually or dexterity challenged. Continuous subcutaneous insulin infusion devices, CSII devices, also known as the insulin pumps, are the most sophisticated form of insulin delivery, and these are small computerized devices that are programmed to deliver insulin under the skin. The insulin pump is durable and lasts for years, but the insulin supply and certain pump components, insulin reservoir, tubing, and infusion set are changed every few days. We have provided more detailed information regarding the insulin pump. And then we have infusion. The human regular insulin may be injected directly into the vein in a hospital setting under close medical supervision only. Insulin is added to intravenous fluids, and the insulin dose and blood sugar are strictly monitored. The intravenous route of delivery is only given under a doctor's orders in a hospital to facilitate the management of diabetes during surgery or intensive care stay. And then we will come to another topic that is related with designing an insulin regimen. The main goal in designing an insulin regimen is to mimic how the body normally releases insulin. If you have type 2 diabetes, there are two main ways to replace insulin: intensive insulin therapy, and then the second one is referred to as conventional or sliding scale insulin therapy, more loosely approximates insulin needs. For intensive regimens, when you are intensively managed with insulin, your medical provider will prescribe an insulin regimen for you. But these are the general principles. Your medical provider should prescribe a basal or background insulin dose. This will be prescribed as 1-2 injections of long-acting insulin, or if you are using an insulin pump, a daily infusion rate of continuous small amounts of rapid-acting insulin. The background basal insulin dose is usually the same day to day. With an insulin pump, you do have the option of temporarily changing the background rate for a few hours up or down as needed. Then a bolus insulin dose to cover the sugar or carbohydrate in your food. This will be presented as an insulin to carbohydrate ratio I to CHO. The I to CHO ratio tells you how many grams of carbohydrate can be covered by 1 unit of rapid acting insulin. You will need to calculate how many carbohydrate you will eat and take a dose of insulin and that matches the food. Then a bolus insulin dose to bring your blood sugar back to the normal range. A high blood sugar correction bolus insulin dose to bring your blood sugar back into the target range. This will be presented as a correction factor. This correction factor refers to how much your blood sugar will drop after 1 unit of insulin, rapid acting insulin. When your blood sugar is too high, you will need to calculate how much your blood sugar is over the target. And based on the correction factor, then the dose of insulin that will bring you down into the desired range. Then there are common intensive regimen for type 2 diabetes such as long-acting insulin, glargine and detamers once or twice a day with rapid-acting insulin, aspart, glulicine, lispro before meals and as needed to correct high blood sugars. Then rapid-acting insulins like aspart, glulicine, lispro delivered via insulin pump. 3 small doses of NPH before meals and a larger dose of NPH at night with rapid-acting insulin, aspart, glulicine, lispro before meals and as needed for snacks and to correct high blood sugar. You should be knowing about sliding scale therapy. The insulin dose is based on your blood sugar. The higher the blood sugar, the higher the insulin dose, and vice versa. The lower your blood sugar, the lower the insulin dose. Sliding scale insulin remains the regimen approximate daily insulin requirements, and common sliding scale regimens are long-acting insulin, glargine, detamers, or NPH once or twice a day, with short-acting insulin, aspart, glulicine, lispro regular before meals and at bedtime. Then long-acting insulin, glargine, detamers, or NPH given once a day. Regular and NPH given twice a day. Pre-make short-acting insulin analogs are regular and NPH given twice a day. So these are the informations that we given you about the sliding scale therapy. Then we have intensive insulin therapy. What is intensive insulin therapy? Intensive insulin regimen attempts to mimic the body's normal pattern of insulin secretion and deliver replacement insulin using the concepts of basal and bolus insulin coverage. When you are intensively managed with insulin, your medical provider will prescribe an insulin regimen for you, but these are the general principles. Your insulin regimen will include a basal or background insulin dose, a bolus insulin dose to cover the sugar or carbohydrate in your food. This will be presented as an insulin to carbohydrate ratio ICHO. The I to CHO tells you how many grams of carbohydrate can be covered by 1 unit of rapid-acting insulin. A high blood sugar correction bolus insulin dose to bring your blood sugar back into the target range. This will be presented as a correction factor. This correction factor refers to how much your blood sugar will drop after 1 unit of insulin, rapid-acting insulin. There are multiple daily injections of insulin MDI or insulin pump therapy. With MDI, glargine, detamers, or NPH is used to provide basal background insulin, and insulin aspart, glulicine, lispro or regular provide bolus, mealtime, and high blood sugar correction coverage. With an insulin pump, insulin aspart, glulicine, or lispro provide both basal and bolus insulin replacement. Intensive insulin therapy, injection of pumps to mimic the body's natural system. The advantages of intensive insulin regimens are while intensive regimen requires more calculation at each meal, they allow for a more flexibility in timing and in the amount of carbohydrate content in meals and snacks. And then an accurate insulin dose will also result in better good glucose control and fewer higher and low blood sugars, and changes in the activity and stress can be accommodated without sacrificing glucose control. Over time, high blood glucose correction can be separated from the food coverage. For example, if your blood sugar is very high, over 240 mg per deciliter, you can delay your meal and give yourself a correcting dose. Once your blood sugar falls below 200 mg per deciliter, you can inject your meal insulin and then eat. Learning these important skills will make managing your diabetes easier. And thank you for listening this video, and if you have liked this video, then don't forget to and subscribe it and share it with others. Have a wonderful nice day. Thank you very much.